All right, so this is my friend Megan Walker. Oh,
Let me turn it down. Look at that.
you can't see anybody? Do you have your screen facing the right way? Because we can see you. Gotta love technology.
Where would I do that?
Why is your entire screen black?
I'm so glad we practiced this yesterday.
Yeah, but we didn't practice on the laptop.
Huh.
Well, we can see you, and I'm going to be sharing your.
So should I just scoot over next to you?
No, you can just talk to. See, look.
Oh, okay.
Are you going to pull up your PowerPoint?
Oh, okay. So I can just get out of there then.
Well, no, but yeah, you can do that.
Okay.
Okay. I am going to be sharing and actually mute. Well, I'll do it in a second.
I'm going to turn it down.
Okay, because I'm going to mute me on this side. Okay, so what we're going to do is we are going to be sharing. I'm going to be sharing my screen so that you guys can see the presentation. Okay, give me a second here. And as soon as it loads, here we go. We are going to present and get started. Let me back it up to the beginning.
You can just tell me what slide we're on and I'll look at your computer, I guess.
Okay. Why is it not backing up more? Come on. Don't be difficult. There we go. All right, this is what we're going to be starting with. I'm going to turn the time over to Megan Walker, and she's going to talk to you guys a little bit about fluoride and xylitol and what those things do to prevent tooth decay. Give me a thumbs up if you can hear Megan. Okay. Can you hear her now?
Can you hear me?
But do we sound like we're in an echo chamber?
Yeah.
Okay. Mute you.
Mute me. Okay.
Can you hear her now?
Can you hear me?
Okay.
They can hear me. Okay.
I'll just turn mine all the way up.
All right, there we go. It's so funny because if I just went like this, okay.
We're here together. Okay.
All right, everyone. My name is Megan Walker. I'm a registered dental hygienist. I have been for about 9 years. I was a dental assistant first. We can go to slide 2 here. I was a dental assistant first, right out of high school. I knew I wanted to be in dentistry. My teeth were really messed up. I mean, they were poking in all different directions. It was a huge insecurity of mine when I was young. In fact, there wasn't a picture of me smiling before the age of 12 because I was insecure about it. So I knew I wanted to go into dentistry because it changed my life as a kid when I had braces, and it just really meant a lot to me. And it changed my entire personality when I fixed my teeth, and I really loved it. So I went in, I became a dental assistant. I really loved that. And then I left, had children, came back, went to school, got an associate's degree, which is just a 2-year degree. And that is all that is required to be a dental hygienist as of right now. That may change in the future. It's leaning towards bachelor's, so that's what I'm doing now. I finished my bachelor's in about a month. So, and I wouldn't have been able to do any of it without Mrs. Allo. So you guys are so lucky to have her because she's been my personal side teacher for the last 2 years. So I couldn't have done it without her. I became a dental hygienist after completing my degree at San Joaquin Valley College, which is just here in Ontario. It was in Rancho when I did it, but great school. You have to become state licensed. I did that as well. Very stressful. You have to like actually have a patient in the chair and someone watches you and make sure you do it correctly. So I've been married to my wonderful husband for about 9 years, and I'm a mother to 3 kids, Brandon, Taylor, and Mackenzie. They're all old now. My youngest is 16. She's at a junior in high school at Etiwanda High School. And I have 2 very special dogs. One is Benson. He is my middle daughter's service dog. He's amazing. He's a golden retriever. And then I have a brand new baby, a French bulldog. Her name is Bailey. So she's my pride and joy right now. All right, so let's get started. Hopefully you guys took that pre-test. I don't expect you to know anything. If you do, that's awesome. You're ahead of the game. But hopefully you answered as best you could without Googling the answers. All right, and then here's a cool little video for you to start.
They call me up now, cause I don't brush. Oh, I like my teeth like this. They call me up now. No, I won't brush. How's about a little kiss? I got more beef in my teeth, got some chicken too. Ouch, that's a cavity. Hey, that's new. Well, if you don't brush your teeth, then kids you do can be a yuck mouth.
Don't be a yuck mouth. Another nutritional message from the ABC Television Network.
Okay, hold on. We're not yuck mouthing again. There we go.
All right, so what do you think? Do you think oral health is important? Most people think it's just brushing your teeth so they don't look yellow and you don't have bad breath, which is, you know, both of those things are important. But actually there is a huge link between your oral health and your overall health of your entire body. So it is super important. I feel super blessed that I can educate and motivate people about their oral health. So let's see here. A couple things on this next slide. Dental health. I've got a statistic up here, but preventative oral hygiene should include brushing and flossing after every meal, which brushing after every meal can be hard, especially if you're at school, which you're not now, so should be easier. But brushing after every meal, flossing at least once a day, but after every meal would be ideal. And then regular visits to your dental office for cleanings and of course exams and x-rays and that sort of thing. Causes of tooth decay: poor oral hygiene, lack of proper brushing and flossing, lack of regular dental visits, poor dietary habits, eating a lot of sugar and sticky candy. Now I tell my 65, 85-year-old patients the same thing I tell my 5 and 6-year-old patients. I love this analogy because it's very simple to understand. Every time you eat anything, especially sugary foods, there's bacteria that lives in the mouth. We call them sugar bugs, but they eat all the food you leave on your teeth and then they go poop on the teeth. That's pretty gross, but it's, you know, it's science. They excrete this byproduct. It's called plaque. It is super acidic. And if left on the teeth, it's going to cause holes in your teeth, which are cavities. Interesting is if you leave all this acidic plaque on the teeth and you don't brush and floss it off, as well as getting holes and cavities in your teeth, your saliva is loaded with calcium and it tries to combat this. It tries to keep your teeth healthy, but what it ends up doing is it calcifies that plaque to the teeth, creating tartar, which is where I come in. I need to remove that. I scrape that off of your teeth. It's so satisfying. You ever watch those videos that are like satisfying videos. That's what I get to do. I get to scrape all that gunk off your teeth to create a healthy environment. So that's just a little side note of what I do, and also why it's so important to brush and floss your teeth. What is a cavity? That is what I just said. The acid from the bacteria in your mouth sits on the teeth and creates a hole. A cavity just means a hole. So a cavity is caused by the acidic byproduct by bacteria. That's the sugar bug poop I was just talking about. And that eats away at your enamel and creates a hole in your tooth. It also creates a whole lot of other problems too, systemically. Periodontal disease, which is my passion. It's what I want to cure everyone from. Bleeding, inflamed gums, infection. Your body having an infection creates infection. Your whole entire system has to fight that infection. Just think about it. Bleeding gums, bleeding, inflamed problems in your gums. If you laid that out across your arm and had infection and bleeding wounds on your arm, and you walked around like that every day, all day, somebody would stop you and say, get that looked at, treat that. Why are you walking around with infection? Well, it's the same thing when it comes to dental problems. People have infection. You can almost smell it, and you know it's happening. It smells like decay. So you would definitely want to treat that in the mouth. It's just as important in the mouth. So we'll go to the next slide here. I have another little video for you to watch.
Have you ever looked inside your mouth at the big teeth in the back? These teeth are called molars, and they have indentations and grooves on their tops and sides. This is where decay and dental caries starts. There are a few things that you can do to help prevent cavities from developing. Brush your teeth twice daily after meals or snacks for 2 minutes. Also, avoid really sugary snacks, sodas, and energy drinks. Otherwise, your teeth could wind up looking like these. The pits and indentations of your teeth accumulate bacteria. If the bacteria are allowed to stay, bacterial aids and enzymes could break down your enamel. Acids and enzymes from foods and drinks can also dissolve away the enamel. Bacteria plaque can also be found along your gums, the sides of your teeth, and between your teeth. This is why it is so important that you brush all surfaces of your teeth by angling the bristles of the brush to get below the gums and in between the teeth. Don't forget to floss every day to help rid your teeth of the fuzzy plaque. When letting plaque remain between your teeth, you can get a cavity there. If a cavity forms in between your teeth, this may result in removing more of your healthy tooth structure than normal to reach and fix the cavity. This area is also the most common area for gum disease to start.
There we go.
All right. I like that video. I have no idea who Midtown is, but they said it pretty nice. Okay, so I'm going to give you 2 really cool products that are going to be in your arsenal for the rest of your life. These things are amazing at helping prevent these disease processes, cavities on your teeth, and also really helping you with your oral hygiene regimen. So the first thing is fluoride. You've probably all heard of fluoride. You have fluoride, since you're young. It's been in your water. It's been in your toothpaste and all of your products. So National Health and Nutrition Examination surveys have shown evidence that adolescents up to 17 years old experience decayed, missing, and filled teeth. So that means that means right now at your age is crucial. We're not always good. We stay up late, we snack, we eat all day long, and we're not protecting our teeth. We're not maybe brushing as good as we should, or, it's just hard. It's hard to keep our teeth strong. So fluoride is going to be your biggest ally here. Fluoride is an ion, and it really adds strength to your enamel. So there's many ways to obtain fluoride. Systemically through water. Now, most people don't know this, but it is actually in your water. There's always a little bit of fluoride in water, but some you can even purchase that has more. But most communities add fluoride to water to keep that in your system. Fluoride supplements, we can actually get it through products such as toothpaste, mouthwashes, vitamins, rinses, and gels. And we also give it to you when you come into the dental office, a little bit stronger fluoride. It's going to really ionize, it's going to prevent, makes the enamel more resistant to decay. It strengthens your enamel so that it can fight off decay better. Let's see here. So water fluoridation, there was a study done, Grand Rapids, documented proof that fluoride is a mineral found in the rocks and soils, and it can prevent tooth decay. So this is making it the first preventable disease in history. What was cool about this is there were communities where they found that the people did not have tooth decay and they couldn't, you know, and this is where it came. Wow, it was in their water. And then there are communities where they had no, you know, fluoride or minimal fluoride in the water, and that they saw rampant tooth decay. So now what we do in communities with water fluoridation processes is try to balance that out. Where they lack, they put fluoride in the water. Some people don't know that, so that was pretty cool. All water contains some fluoride, like I said. Fluoride has been proven to protect teeth from decay. Bacteria produce acid when you eat sugary foods. This is what I went over a little bit before. This makes, it breaks down this enamel. And you know, the interesting fact is enamel is the strongest material in the body, stronger than bone. So for something to really degrade it like that and break it down, we really want to protect our teeth. So this makes the tooth weaker. The bacteria just constantly attacking the enamel makes the tooth weaker and increases the chance of those cavities. Fluoride helps to rebuild and strengthen that enamel. Water fluoridation provides regular contact with low levels of fluoride. So that's why it's so important that it's in our water, because it's constantly, we're constantly getting that fluoride. Community water fluoridation is the process of adjusting the amounts of fluoride in drinking water to a level recommended for preventing tooth decay. Like I said before, some had too much, some didn't have enough. So water fluoridation is extremely important. Okay, so when at your dental visit, professional fluoride has a concentration of 0.20%. These are supervised topical fluorides that can be applied to your teeth through gels and mouthwashes. How many? I know that when you guys go for your 6-month cleaning, at the very, very end, they'll say, okay, here's your mouthwash or here's your gel. And it's always your worst. Like, people hate this part, but it's actually one of the most important parts. That is stronger than you can get with the over-the-counter products. And that's really, usually it's like 2 minutes you have to swish if that's the kind you're using at the office you go to. But it's super important. There's no real way to hide that flavor of fluoride. I mean, they've tried berry, whatever, but it always has that taste. But just know that you're just strengthening your teeth when you do that. So it's super important. Also, you can ask if your office happens to have a varnish. That is my personal favorite. The varnish is something that's painted on, kind of like nail polish, painted on those deep grooves on your molars and on those high risk areas. And the reason I like varnish is it's stronger. It's a strong 5% varnish, but it's slow releasing over about 4 or 5 hours on your enamel. So even long after you leave, you can eat and drink, and that's still strengthening your enamel. But when you're at home, that's just when you're in a dental office, when they give you fluoride. When you're at home, over-the-counter toothpaste, mouthwashes, they can be used daily, 3 times a day, more than that if you want. But fluoride toothpaste is the most cost-effective way to get fluoride. Most every toothpaste you buy, unless you buy some that are natural and don't have the fluoride, they're there to prevent tooth decay. Now, some people may be more holistic and choose not to use fluoride. I believe fluoride to be safe. If you have a family member who is adamantly against fluoride, then I'd strongly recommend looking into something called MI paste. I really like that. It's a calcium and phosphate plate paste. It adds calcium to the saliva. Where I love fluoride, because fluoride actually strengthens your enamel, this will do something a little different. Not as effective as fluoride, but will help. So that's just a side note. But studies have shown that the use of fluoride toothpaste reduces decay by 15 to 30%. So that's huge. You know, good oral hygiene habits and using fluoride is going to be your best bet. And keep in mind, your teeth the teeth you have in your mouth right now, you're all 8th graders, so I'm pretty sure you all have your permanent teeth. Those have to last you your entire life. You want to be 100 years old with the teeth you have in your mouth right now. So you need to take care of them. And fluoride is a way to do that. So as we move into the next product that I love, I'm going to show you another video.
So I can tell you're my friend because I always show
Well, you helped me make this up.
Oh, no, no, no. Huh?
Okay, so xylitol. That was a cool little video. It was like the coolest one I could find. So xylitol's kind of newer. I don't remember hearing about xylitol when I was young. Xylitol is actually a natural sweetener that's a derivative of plant. It's pulled from a leaf. It looks and tastes just like table sugar. In fact, you can buy xylitol to sweeten your drinks or I think you can cook with it. I haven't tried, but I know that they sell it in bags too. But it's actually been used a lot in dental products or even just gums and mints like Mentos or, some of the Tridents or any kind of gums that you can find. A lot of them at Sprouts or some of the more natural stores will have xylitol sweetened products. Side note on xylitol, keep it away from your animals. For some reason, it can be bad for animals. So you don't want them to get a hold of that at all. But xylitol is awesome for a couple of reasons. Xylitol helps decrease the incidence of caries, tooth decay, by increasing the salivary flow and the pH. It also reduces the number of bacteria in the mouth. It reduces the plaque levels. Xerostomia, we call that's dry mouth. Inflammation of the gums and erosion of the teeth. So xylitol really helps. So in layman's terms, in terms that help my patients understand, remember when I was telling you about sugar bugs and they eat what you leave on your teeth and then they go poop on the teeth and that poop is plaque. It's really acidic. Well, in layman's terms, xylitol constipates bacteria. It constipates those sugar bugs so they can't go poop. So that's pretty cool because then you don't have as much plaque produced, which produces the cavities. Does that make sense? I can't see you guys. I hope that makes sense.
Give me a thumbs up if that makes sense.
Cool. All right. You're going to remember that.
Thank you.
I know. I had a patient once tell me, I can't believe you used the term constipation while I'm in your mouth, but it's true. This is just an easy way to understand. So xylitol is the main ingredient in a lot of products like we discussed. Ice Cube's gum is one of them. There's been studies that show children who chewed xylitol gum had significantly lower a rate of dental decay. And after 24 months compared to children who did not chew the gum. So studies have shown this is really effective. So when you go to shop for your gum, check and see if it has xylitol in it. I mean, we all chew gum, right? So it's an easy way to help protect your teeth. Those teeth you want to keep till you're 100 years old, right? All right, so let's review. Poor oral hygiene habits lead to tooth decay. Obviously, if you're not brushing off that bacteria, that plaque. Bacteria feeds off the food you eat in your mouth, creating those acids that attack your enamel, causing cavities to form, right? Big holes. And you know, I don't know if you understand that either. I just want to kind of go over that for a second. Cavities can be, or decay can start off very small, just a tiny little filling, not even a big hole. It turns into a big cavity. That can be a big hole that needs to be filled. Some of you have had to have the drill or the laser and fill that tooth. It could get even bigger than that and get to the roots. You'd need a root canal. It can get even bigger. You know, you need a crown, the root canal, then you need a big crown that you put on your tooth because there's so much that's been destroyed. And then eventually you lose the tooth. So ultimately, if you don't have teeth, you can't eat good food. So let's keep all of our teeth. So that was a side note. Fluoride protects and strengthens and that enamel against decay. It's kind of like an armor for the enamel to keep you protected. It's found naturally in water, rocks, and soil. Also, they put it in toothpaste, mouthwash, and supplements. Xylitol is on the other side. It's easy to get as well, and it's going to help in that different way. It's that natural leafy sweetener, and it can decrease the incidence of bacteria in the mouth through mints, gums, and I think they're even adding it in some other products as well. Just at the bottom here, it's in a report by the Journal of the American Dental Association. Dental decay, caries is another word for decay, are considered to be the most common chronic disease globally. So the most chronic disease is tooth decay. So that's crazy when we have the tools to prevent it. So
Bigger than COVID-19.
bigger than COVID. COVID's so bad though, you guys. All right, does anybody, I kind of talk fast and I get right to it, but I tried to keep it pretty simple, but does anybody have any questions?
Ask a question, get a prize.
I have a question actually.
There we go, Gabby, that a girl.
Question.
So gum with xylitol, like eating that, maybe not constantly, but it could help you basically.
Yeah, absolutely. So like I said, let's say you're at school or you're somewhere where you don't have a toothbrush and toothpaste in your pocket.
You're not allowed to chew gum at school.
Okay, oh, I'm sorry, not at school, not at school. But let's
Although
just
that's
say,
a good argument.
let's say you're eating lunch at the gardens, okay? And you're not gonna pull out a toothbrush and toothpaste and floss and brush and floss your teeth because it's not practical. You're gonna go to a movie after. If you have xylitol gum, one of the gums that have xylitol or a mint, and you pop that in your mouth, you're already doing something to take care of your teeth because you're preventing that bacteria from producing the acids. So like I said, it was constipating the bacteria. It's going to create a healthier environment for your mouth. So yeah, absolutely. It's
So
good to have.
well, I think in other words, if your parents don't let you chew gum, there's your argument right there. Well, xylitol is going to keep me from having tooth decay, which is the #1 preventable disease worldwide.
Yeah,
You
there
might
go.
just blow your parents away with that one.
But however, there are mints that you can use. Mints are a little
Okay. All right,
you can
Derek.
suck on the mint.
Derek says, but he has braces. Well, you can use mints too, because mints
yes.
is another thing. Just check on the label. And I've seen it after I've gone over this with her. I've looked and they will actually have on the package, it'll say like with xylitol, or you know what I mean? Like it'll have it on there. So
And
that's something to look at.
For you with braces, for anybody with braces, I will say it's even more important to prevent that bacteria production because there's nothing more traumatic for parents who have paid thousands of dollars for you to have these beautiful straight teeth. Decay can happen slowly and it's not always a hole. Sometimes it's scarring, discoloration around those brackets. And that's from the acid of the plaque sitting around the brackets too long. So it's not always feasible to pull out all those tools, but if you had a mint that had xylitol in it, it could help you a lot. Also a water pick, my favorite thing. And, brushing and flossing using those threaders, especially for you.
Okay, Chiagozi, you have a question. Go ahead and unmute, sir.
Has there been anybody that doesn't have any teeth?
Yeah, there is a huge, the dentures are huge. People, and you know
Fake
what?
teeth.
Yeah, the implants are expensive, and that's a great option. If you've lost teeth, you get an implant. Those are kind of costly. People who've lost all their teeth typically have dentures, and let me tell you, that's not something you want to do. I mean, it's an option for them, but it's not great. When you don't have roots in your gums, in your bone, you lose bone. So you'll often find that grandparents or whoever has dentures, they have to keep going back and they're loose fitting and they have to keep going back and replacing them. And that's because they keep losing more and more bone since there isn't a live root in their bone. And so it's so much easier to take care of your teeth. And most of those people will tell you they wish they would have taken care of their teeth when they were younger, as to not lose their teeth, because it's really miserable. It affects how they eat. It affects their nutrition, their overall health. So yeah.
All right, Roberto, unmute yourself and ask your question, sir.
All right. What are the most disgusting teeth you've ever seen?
So,
I knew that was coming.
So here's what's crazy. My kids love my stories. The more inflamed, infected, and what you guys would call disgusting, I get super excited about that. I'm in a really cool spot where I can create health. And so when you see something that is bloody and buildup is really thick and heavy, I feel like I get to sit there with my patient for longer than most healthcare providers do. And I can talk to them the whole time I'm cleaning their teeth by, educating them on how they can stay healthy. And I get to start off with something that might be really a lot of gunk on there and blood and infection. And I get to clean it all up. And almost instantly you can see a difference. And also people's mouth, it's a very big insecurity for them. So when they see it cleaner, they want to get healthier. They start to learn about the link between their infection in their mouth and their whole body. I just feel very blessed that I get to create health on somebody, and teach them about health in their mouth. So it's exciting. And I love those big chunks flying off. Like it's like I said, it's satisfying. It's really fun. It's a great job.
All right, Jonathan, unmute yourself and ask your question.
So how you said that there are best. Okay. So you know how there you said that there are infections in your gums. What if it happened on your tongue?
So there are different oral infections that can happen on your tongue, candidiasis, different things like that. Usually the infections that I see in the mouth are linked to systemic diseaes.
Okay, I have a story.
Somebody who may be HIV positive, they could have a lot of, fungus type things because it decreases their immune system. And so then they would have an infection in the mouth. Interesting. There's so many overall diseases, diabetes, like I said, immune deficiency disorders, things that they open their mouth and I can automatically say, ooh, are you sleeping with your mouth open? Are you breathing okay? Do you have dry mouth? Are you on medications that are causing this? So it isn't just about cleaning teeth. My job is actually about the whole body.
So I have a story about this actually. My daughter's friend that she plays volleyball with, her mom went to a regular dentist appointment and the doctor saw a little white dot on her tongue. And it was a little concerning to him. And so he told her she needed to go to her regular doctor. It turns out that she actually was diagnosed with cancer, and it was on her tongue and on her lymph nodes here behind her neck, behind her ear. And she has since had to have 2 surgeries. However, the oncologist, who's the cancer doctor, told her if her dentist had not have noticed that that was not a normal feature for her tongue, that she very well could perhaps have died from cancer very quickly because it was very quick spreading. And so literally she went from the dentist to her doctor to surgery, to both surgeries in like a month's time. So, you know, it is something to consider. It isn't always just about keeping your teeth clean, you know, like she's saying, it's about overall health, the health of your body from, you know, head to toe. Erin, you had a question. And you guys, I know we're past time, but you always know that I'll give it back to you. You know that. Do we know specifically which gums have xylitol?
Yes, so the strongest xylitol products are going to be like Epic. Epic is huge. As far as the more mainstream xylitol gum, like Trident, I believe does. Ice Cube's gum brand does. But definitely you just want to read, or maybe you do a Google search for the ones that have the most. But I do know that there's an Epic brand and a xylitol brand itself.
Well, and that one, it said Spry.
Spry.
You could
Spry
probably,
that's from Sprouts.
Yeah,
Spry is a good
there's
one.
and you can also probably get some of these on Amazon.
Sure, yeah. But most grocery stores and drugstores like Sprouts and Trader Joe's, those places all have it too.
All right, guys, I think if I'm not mistaken, and thank you guys for your participation.
Post test.
Post test. So I'm gonna go ahead and stop. Oh no, I can't stop sharing.
Oh, sorry.
Because if I stop sharing, we stop. Oh no, we can stop
that's
recording.
right.
So she can say goodbye.
Yeah, well, I'm going to give you guys a post test now. It's part of my program requirement. I really just want to know if I communicated what I was supposed to you effectively. But I thank you guys so much. And like I said, you're so lucky to have Mrs. Allo. She's my favorite. Thank you for being nice to me, guys.
She was so nervous. I told them how nervous you were.
I could never. Listen, cleaning teeth is easy compared to this. But anyway, I really am grateful for this time. Thank you so much.
And Aaron said his favorite gums are Trident and Ice Cube, so he's good to go.
You're good. That's awesome.
All right, I'm gonna go ahead and stop sharing. Oh wait, we've got one more item in the chat. Oh, Minecraft cubes. You're so silly. Okay, we're gonna go ahead and stop sharing, and I'm gonna go ahead and we're going to, I'm going to stop recording. Everybody say goodbye to Miss Megan for me, please. Thank you, thank you, thank you. You guys are great. You're wonderful. Love you guys. I told you guys you were awesome. Okay, so I'm going to stop.